Knock, knock, knock.
Come in.
Hey, I'm Ashley. I'll be your nurse today. Hand hygiene, privacy for my patient. As I walk into my patient's room, I'm already beginning my general inspection. I am looking at my patient's facial expressions, alertness, skin color, and eye contact. I'm also checking for any physical deformities, dress, and grooming. As I go on with my inspection, I will check my patient's level of consciousness and orientation and any vision, speech, or hearing concerns. All right, so now we'll begin. Hey, can I get you to state your name and date of birth, please?
Brianna Crawford, 8405.
All right, just checking the wristband. All right, thank you, Miss Crawford, for that information. Can you tell me why you're here today?
A checkup.
All right, awesome. Your doctor has ordered some assessments on you. But before we begin with that, do you have any allergies?
Just coconut.
Coconut. All right. Are you in any pain today?
No, ma'am.
All right. Do you know what month it is? Or can you
March.
tell me what month it is? March. Okay. Can you tell me who the president is?
Donald Trump.
All right. My patient is oriented to time, place, and situation. My patient is responding to me, so that tells me she does not have any issues with hearing or speech. My patient's making eye contact with me and having normal facial expressions. So next I will move on to the skin, hair, and nails. So I'm assessing my patient's, skin, scalp. Yes. All right, so I'm assessing my patient's scalp. I do not see any like flaky skin or any skin lesions, anything like that. Then I will assess my patient's, hair. It is well groomed, so no concerns there. Then I will inspect my patient's skin color and pigmentation and temperature. So her skin color is consistent with her ethnicity. So I'm checking my patient's temperature. All right. She feels warm and dry. Next, I will inspect my patient's hygiene and nails. So her hygiene appears clean. Her clothing is appropriate for the weather. So no dirt visible under the nails. I will do my capillary refill now. Capillary refill is less than 2 seconds. And while I'm here, I'll go ahead and do my edema check, just because. All right. Well, let me start here, sorry. All right. No edema present in upper or lower extremities bilaterally. Next, I will talk about the Braden risk assessment. So 3 risk factors would be mobility, nutrition, friction, and shear. Have you noticed any new skin lesions?
No, ma'am.
All right. Awesome. Next, I will move on to my head, eyes, ears, nose, and throat assessment. So I'm inspecting my patient's head for symmetry. Her head is symmetrical, no abnormalities. I will inspect my patient's ears. Ears are symmetrical, no visible drainage. Do you have any previous head injuries?
No, ma'am.
All right. Are you having any trouble hearing?
No, ma'am.
All right. Next, I will inspect my patient's eyes. Oh, I need to do the hearing test. Yes, okay, before I do the eyes. Okay, shoot. Let me do that real quick. Okay, so if I could get you to cover one ear, and I'm going to whisper a phrase to you, or I'm going to whisper a few things to you. Cover the other ear for me.
Oh.
Yeah, leave that one. All right. You can just put your finger right there.
Okay.
Just light pressure. There we go. All right.
C35.
All right. I'll move to the other side and do the same thing.
A3K.
All right, awesome. My patient doesn't appear to have any hearing issues. Next, I will move on to the nose. Excuse me. All right. So, nasal mucosas look intact, moist, and pigmented to ethnicity. And I will do the nasal patency test if I can get you to cover one nostril and take a breath in for me. All right, then the other side. All right, awesome. Do you have any are you getting any frequent nosebleeds?
No, ma'am.
All right, next I will inspect my patient's mouth. All right. Mucosa is pink and moist, no visible tooth decay. Then I will do my patient's, for the mouth, are you having any trouble swallowing?
No, ma'am.
All right, and then let me look at your neck structures, and then can you swallow for me? All right, awesome. All right, no issues there. Next, I will do my patient's eyes. If I get you to just look straight ahead for me. All right, and then the tip of this. All right, pupils are perla, and they are about 4 millimeters. Are you having any trouble seeing?
No, ma'am.
Are you having any, I asked you about the nosebleeds. Okay, never mind. I'll move on to my neurological. All right. My patient is conscious and oriented to person, place, and time, situation. Next is my Glasgow Coma Scale. So, so you would do the Coma Scale if the patient after a brain injury. So you would be checking for eye opening, motor responses, and verbal responses. All right. Have you had a previous head injury?
No, ma'am.
Okay. All right. Next, I will move on to my respiratory. All right. If I get you to, there you go. All right, respirations are 16 breaths per minute, even, unlabored. Next, I will auscultate lung sounds. All right, I'll start with the upper right lobe. Every time you feel my stethoscope, just take a deep breath. Upper left lobe, I'm going to displace your breast. Lower left lobe. Middle right lobe, and then, okay. Lower right lobe, lower left lobe, upper left lobe, upper right lobe, right middle lobe, left lower lobe. All right. Do you have a cough or mucus production?
No, ma'am.
All right. Well, I'm going to educate my patient on the incentive spirometer and turn cough and deep breath. So this is a incentive spirometer. So what you would do is you would put this in your mouth and you would take a deep breath in, hold it for a few seconds, and then blow it out. You would do that about 10 times an hour. Can you explain that back to me?
Put this in my mouth, breathe in, hold for a few seconds, breathe out, and then I do it about 10 times an hour.
All right, awesome. Next is turn, cough, and deep breathe. So if you were stuck in bed sick, you could turn over on your side, take a few deep breaths in, and then cough. That would help get any kind of mucus up out of your chest.
So I lay in bed, turn over, take a few deep breaths, and then I cough, and then I'll get mucus out of my lungs.
All right, yes, ma'am. Are you having any trouble breathing?
No, ma'am.
All right, awesome. Next, I will move on to my cardiac assessment. I will assess for jugular vein distension, no jugular vein distension. Next, I will palpate pulses bilaterally. So I'm going to do the radial pulses, radial pulse 3+ bilaterally. Next is the posterior tibial, 2+ bilaterally. Next is the dorsalis pedis, 2+ bilaterally. Other pulse sites would be the carotid, the axillary, the brachial, the femoral, and the popliteal. All right. Let's see. Have you had any chest pain?
No, ma'am.
Okay. All right. Awesome. Next, I will auscultate for heart sounds. I have already done my capillary refill and my check for edema. Excuse me. All right. On the right side, second intercostal space is the aortic. All right. Left intercostal, second intercostal space on the left side is pulmonic. Third intercostal space is herbs. Fourth intercostal space is tricuspis. We'll displace your breast. Fifth intercostal space is the mitral valve, also where the apical pulse is found, which you would auscultate for 1 full minute. Are you having any chest pain?
No, ma'am.
All right, awesome. Next, I will move on to the gastrointestinal. If I get you to lay down for me. In a real setting, I would have my patient lift their shirt so that I could inspect their abdomen area and do my stethoscope on bare skin. I would also do bare skin for auscultating breath sounds and heart sounds, but for privacy purposes, we will not. So on my inspection of the abdomen, I would be looking for any skin lesions or any kind of hyper or hypo skin pigmentation. So for video purposes, my patient does not have any skin lesions or any pigmentation issues. So next, I will move on to auscultating bowel sounds. I will use the diaphragm of my stethoscope for this. I will start in the lower right quadrant, and then I will go to the upper right quadrant, and then the upper left quadrant, and then the lower left quadrant. And you would listen for 1 full minute. If no bowel sounds were heard, you would listen for 5 full minutes. Bowel sounds are heard in all 4 quadrants. Next, I will use the bell side of my stethoscope and listen for vascular sounds. First is the aortic. Next is the right renal, and then left renal, and then the left iliac, and then right iliac. All right. When was your last bowel movement, Miss Crawford?
Last night.
All right. And are you passing gas?
Yes, ma'am.
All right. Are you having any issues having a bowel movement or any changes in your bowel movements?
No, ma'am.
All right. Also, I will palpate my patient's quadrants. First will be the right lower quadrant, and then the right upper quadrant, left upper quadrant, and then left lower quadrant. All right, next I will move on to my musculoskeleton. If I could get you to sit up for me. All right, so I'm going to be testing range of motions. So I'm going to do the elbow and the wrist. If I get you to flex and then extend. All right, and then we'll do it on your wrist. Extend up, there you go, or hyperextend, right? All right, awesome. Push down on my hand for me, and then push up on my hand, and then push down, and then up. All right, I'll do this one. Extend, flex, all right, and then hyperextend. All right, push down on my hand, and then up, and then down, and then up. All right, next I will do the lower extremities. I'm gonna do the knee and the ankle. Extend, flex, extend. All right. All right, and get you to push down. All right, and then push up. Okay, and then okay, awesome. Now I'll do your ankle. Flex, extend. Yep. Hyperextend. Okay. And hyperextend one more time. All right. Get you to push down on my hand and then push up. Okay. Yeah. All right. All right. No range of motion issues with my patient. They seem to have full strength in all 4 extremities bilaterally, or all 4. Yeah. No crepice, cracking or popping was heard, so that's good. Next, I will assess my patient's gait. If I could get you to just walk a little ways, and then we'll turn around. All right, we can turn around. Next, I want you to walk heel to toe for me. I'm assessing my patient's gait and balance. All right. Thank you, Ms. Crawford. My patient's gait and balance is normal. They seem to be walking fine, no limping, no balance issues. Let's see. Do you have any joint issues, like previous joint injuries?
No, ma'am.
All right, awesome. Next, I will assess my patient's GU system. For privacy purposes, we will not be doing that. We'll just ask a subjective question. So my subjective question is, are you having any trouble urinating?
No, ma'am.
All right, awesome. Next, I will do the fall risk and safety precautions. So fall risk, have you fell in the past 3 months?
No, ma'am.
All right. My patient has not fallen in the past 3 months. They do not have a second diagnosis, as they are here for a checkup. They do not have an IV. They did not use an ambulatory aid when coming in, and they are oriented. So my patient is not a fall risk. But for video purposes, for fall risk preventions, do you have any animals at home or any exposed wires or clutter in your walking paths?
Yes, ma'am.
All right. So it is advised with pets to be very careful, as pets can trip you up when you walk. So when you're walking, just be mindful of them and don't let them trip you up. You could also wear shoes if you don't want to wear shoes inside your house. Some grippy socks will suffice. That'll help you keep your feet on the floor a little better. And as far as the cords and any kind of clutter, just removing any cords or clutter out of your walking path, because that is a trip hazard.
Okay.
All right. And I think I did the glass scale, coma scale. Pretty sure I did. Okay. I think I got everything.
I think so too.
Did I do your temperature?
Yes.
Okay. All right, well, I guess that's everything then.
Yay.
All right, the doctor will be in shortly.
Thank you.
Thank you.